My name is Alex Nagy, N-A-G-Y, and I was diagnosed with two cancers. One is esophageal cancer, and the other one is called GIST, G-I-S-T.
My mother's initial diagnosis was myelodysplasia, type of leukemia. My husband and my son and I were living in New Jersey at the time. Another World was still on the air, so I was working back east, and my mom and dad were in California. And I remember exactly, I was standing in like the little entryway of our house and kind of collapsing on the stairs, and I guess the way I called my husband's name, he came running because he knew something was wrong.
I was diagnosed with CML, that was chronic leukemia, about 7 years ago. I've been in remission already about 6, and the doctor said I was doing extremely well with that. I also had a kidney transplant and a urethral transplant.
It was actually January 15th, I believe, in 2006 that we got the first dose of this medication. And getting it at the pharmacy, I thought they made a mistake when they told me it would cost, the copay would be actually about $2,500.
Well, my brothers and I tried to figure out if we could, all pile in, and my brothers with their children, we all, didn't have that kind of resource for $5,000 a month, not even the three of us together sharing that. So she went to several foundations, and it was through PSI that she was able to afford that kind of medication.
There was something that I realized I could do with a family, and I kind of evaluated what was going on in that family's life. And what was going on in that family's life, I thought, well, there are two things that could save this family from becoming financially devastated or in the situation that they're presently in. One was to help them afford their health insurance. Number two was to help them afford their treatment. And it was with that idea, or that acknowledgement of those issues, that I came up with the idea of PSI.
PSI helps people by being a safety net with those expensive costs and gets them through a period so that they can stay financially stable and land on their feet rather than become financially devastated.
Life without PSI would be, you would have to go without a lot of things. I mean, aside from the fact that they help you save your life, it makes a difference in your ability to buy some of the basic necessities of life.
I'd be in a terrible situation unless the Lord undertook and gave me a complete miracle, which I know some things in this life you don't get what you really want. And so that means that I would stand a big chance of the CML coming back up on me.
The demand is outweighing the supply. Just imagine if we could help all the people that come to us and the difference that we can make in their lives. I think that is really the important thing here.
We cannot survive unless we have the financial donations of those who provide support for PSI. We can only assist those we support in direct proportion to the funding we have. But beyond that, I think there are many donors we work with, whether they're pharmaceutical donors or state donors or other donors, who have a real understanding of the plight of these patients.
Talking to people that might provide donations or assistance to PSI to carry on their mission, the only thing I would say is that with PSI, unlike some other organization where you donate money, you can really see the results. And I think it should make a difference for you knowing that you're really affecting people's lives in a visible, tangible way, the one that doesn't just disappear in the ether. So all I would say is God bless you if you can help PSI, because they're helping a lot of people in return.
Thank you so much. Thank you for all your help, not only for my mother, but for the 12,000 and counting that you are helping and guiding, and we really treasure you, your hearts, your efforts. Thank you.